Instant Neuro! Vestibulo-ocular reflex, VOR. Rapid involuntary movements of the eye, called nystagmus, can be induced using the caloric reflex test. This test involves irrigating cold or warm water in the external auditory canal. In the normal condition, the resulting eye movements involve a slow phase of movement in one direction, called the pursuit, followed by a fast phase of movement in the opposite direction, called the saccade. The direction of the fast phase is used to name the nystagmus. An important mnemonic to help you remember the direction of the induced nystagmus is CALS, cold opposite, warm same. This reminds you of the direction of the fast phase of the nystagmus. Let's take a look at caloric induced nystagmus in a healthy volunteer, SpongeBob. Cold water in the right ear induces the slow phase of movement towards the right, followed by the fast phase towards the left. Remember CALS, cold opposite. The fast phase is to the opposite side. Cold water in the left ear induces the slow phase of movement towards the left, followed by a fast phase towards the right. Conversely, warm water in the left ear induces the slow phase of movement towards the right, followed by a fast phase towards the left. Remember CALS, warm same. The fast phase is to the same side. Warm water in the right ear induces the slow phase of movement towards the left, followed by a fast phase towards the right. As the slow component of VOR does not require higher cortical function, we can use caloric testing to assess lesions of the brainstem in unconscious or comatose patients. In these patients, there is no fast component, as this would require higher cortical function. Let's take a look at caloric-induced VOR in coma patient Super Mario. Super Mario's brainstem is intact, so both eyes will have the slow component, so the pursuit only, as this is controlled by the still intact VOR. Let's take a look at caloric-induced VOR in another coma patient, Cookie Monster. Cookie Monster has a bilateral lesion of the medial longitudinal fasciculus, which results in absent adduction, so he will have the slow component only in the eye AB ducting. Finally, we have coma patient Minion Pig. Minion Pig has a lesion of the lower brainstem, so he will have no slow component, as the vestibulo-ocular pathway is damaged. The result is that brain-dead patients have no response, so no pursuit and no saccade to caloric testing. Another way to assess VOR is by using the doll's eye test, in which the head is rotated to the left or the right. The reflex is present if the eyes move in the opposite direction of the head movements, and this indicates that the brainstem is intact. In our bilateral MLF lesion patient, Cookie Monster, adduction is absent. A patient with a low brainstem lesion, such as Minion Pig, will have an absent or negative doll's eye sign. Instant Neuro!